be nice to get that resolved for the claimants. Now, with respect to the opioid crisis, I saw the numbers as well today showing a 68% increase in the opioid deaths in Ontario, and we know that BC was on the front lines of this, and 16 Canadians a day are dying for this. And I heard about the amount of money that the federal government is putting forward, the $6.2 million, and then some of the payments that went to the different provinces. But when I compare that to the $500 million that the government is spending to legalize marijuana, it just seems like perhaps those two are not in balance. And so if the minister could describe what are the actions being taken in the opioid crisis to prevent the drugs from coming into the country, to prevent the overprescription of drugs, to make sure our first responders are well protected, and to invest in treatment to get people off drugs ultimately.
Thank you very much once again, Ms. Gladue, for the question. When we look at the situation that we're facing right now, it's absolutely, and as indicated, we are certainly faced with a public health crisis when it comes to the situation. And again, when I heard the numbers this morning, it's devastating to see the amounts of lives lost in this situation. With respect to the actions that our government has taken, we cannot minimize the actions that our government has taken to date with respect to regulatory changes and also the issue of Bill C-37. Once again, providing access to individuals to supervised consumption sites saves lives. We know that. Also, ensuring that naloxone products are readily available to individuals as well saves lives. Also, with respect to the changes that have been made with respect to providing provinces and territories with the opportunity to open overdose prevention sites. That was an announcement that I made, I believe, about 2 weeks ago, because when we met with the health ministers' meetings back in October, some provinces had indicated that they thought that it would be appropriate if the provinces had more powers. And again, I mean, they're closer to their constituents and they know what's going on the ground. So we took that back, and just 2 weeks ago, we indicated that we were prepared to look at providing class exemptions to provinces if they choose that they want to open overdose prevention sites. The difference between an overdose prevention site and a supervised consumption site, because sometimes we talk about these terms and people aren't aware of the difference. The supervised consumption site, when they choose to apply, the municipality or the area will get in touch with Health Canada, and then from there the licensing will go through that department. It can take a bit more time. When it comes to overdose prevention sites, however, we can certainly go through those requests in a very timely fashion. And just today, Minister Hoskins got in touch with us yesterday, and we were able to approve a class exemption. So then from there, the province of Ontario will be able, to determine what services need to be put on the ground in order to provide services to the individuals in their community. And at the end of the day...
We have to move along.
Okay.
Okay, Mr.